Therefore, Your Excellency, allow me to recognize the other partners who have already recognized Tasor Kungiri for the good service you have given. Thank you very much, Tasor Kungiri. I want to recognize JCRC is one of the partners operating here in the district. I want to thank JRC for the work, good work you have done. I also want to thank EGPAF, that is Elizabeth Grazer Pediatric AIDS Foundation. They are doing a very good work to us. Now, Your Excellency, allow me to invite the Director General of Uganda AIDS Commission, who is going to give us the progress on the Presidential Fast Track Initiative on ending AIDS as a public health threat. You are most welcome. As is coming, Your Excellency, allow me to introduce the ambassador to Uganda, the Tanzanian ambassador to Uganda, who is here with us, the Deputy Chief of Missions from the U.S. Ambassador, William Bent, you are most welcome, is here with us, and His Excellency.
Republic of Uganda, Your Excellency, the Vice President of the Republic of Uganda, Cabinet Ministers present, Honorable Members of Parliament, heads of diplomatic missions, the leaders of local governments, the representatives, including the implementing partners, the representatives of people living with HIV, the representatives of the media fraternity, ladies and gentlemen. Your Excellency, I'm going to present highlights on behalf of the Uganda AIDS Commission Board, management and staff, and the chairman of the Uganda AIDS Commission Board is here in the audience, and the members of the board are also a summary and highlights of some of the things that have been done around the country based on the directives that you gave when you launched the Presidential Fast Track Initiative in 2017. Today is a very important day for us because not only are we commemorating World AIDS Day, Your Excellency, it is the first national physical commemoration outside Kampala since the outbreak of COVID-19. And for the health workers to concentrate on the more ill patients and therefore provided. Your Excellency are given a comprehensive package of interventions that include HIV screening, testing, counseling, school and community-based HIV prevention programs for violence, education support, including subsidies, materials, tutoring, looking out for those who are at risk of dropping out of schools, financial literacy, pre-exposure prophylaxis, as well as condom distribution. And Your Excellency, a minimum of 347,000 adolescent girls and young women were reached. This does not include those that were reached through programs like Skilling the Young Girls and other programs under the Operation Wealth Creation programs. So we are yet to pick all that data, and we added to this number, it would be much higher than what we are reporting here. Your Excellency, we focused on the adolescent girls and young women because when we looked at the data for 2021, in 2021 alone, there were 54,000 new HIV infections, and 15,000 of these were adolescent girls and young women. And they are at particularly high risk because of their vulnerability because of sometimes the need for them to access money to be able to buy their needs. So, Your Excellency, while training these girls, equipping them with skills, making sure they have information and knowledge on how to protect themselves, it's also important to cushion them against poverty so that they have some income and they can buy the routine needs of the things that they need to use. Your Excellency, in this report on page 4, we have a table that shows HIV prevalence by district. It also disaggregates the prevalence between male and female, and also shows the ART coverage, those who are on an antiretroviral therapy. And that way, the different stakeholders are able to follow up and see how to address the interventions, identifying those who are particularly on higher need. Your Excellency, the cause, we've identified that the cause of the persistent high infections is because of, one, lack of comprehensive HIV prevention information and knowledge, but also, as I've said, poverty is the other issue. I would like to acknowledge the contribution of cultural leaders, especially singling out the King of Uganda, the Umukama of Toro, who have, taken on HIV/AIDS among the key interventions that they have addressed. The religious and faith-based leaders, Your Excellency, have also done a commendable job. Uganda AIDS Commission has worked with the Interreligious Council of Uganda, and we've been able to make the messages go out through those platforms. Through the broadcast media, Your Excellency, we were able to send out messages through 47 local radio stations and 10 television stations in the 14 regions of Uganda using 9 local dialects. So we try to reach people through the languages they can understand and working with resource persons from those regions. Your Excellency, on the second directive, it was to accelerate implementation of test and treat and attainment of the UNAIDS 90-90-90 targets, which we've now upgraded to 95-95-95. Because, Your Excellency, these targets were for 2020, and Uganda was among only 8 countries globally that were able to achieve the 90-90-90 by 2020. Thank you. And although COVID affected us, as we speak now, out of the estimated 1.4 million people living with HIV, 1,305,000 of these have tested and they are on antiretroviral therapy. 95% of those are taking their medication and they have achieved viral suppression. And we know, Your Excellency, that when you take your medication well, it means that you don't pass on the infection to your partner. The challenge remains with children. The children are not doing as well. Children between 0 to 14 years. For some reason, they are not, not all of them are accessing treatment, and even for those who are accessing, the adherence is not very good. So we will work with yourself and the leaders to see what are the issues. One of the issues has been stigma, because we know that some of the partners living with HIV have not necessarily disclosed to those that they live with, and that makes it difficult to support them and adhere to treatment. The third area, Your Excellency, where you directed was consolidating elimination of mother-to-child transmission, and 98% of the mothers who were pregnant and had HIV were able to receive antiretroviral therapy. But we saw that decline because by the time they delivered, and when you look at the viral suppression, that percentage reduces drastically to 91% when they were followed up by the time of breastfeeding. So while we made progress, especially working with MAMA in ending pediatric HIV and AIDS, Your Excellency, we need to focus on this area again because we are seeing more babies acquiring HIV when actually they shouldn't, because we have the means to make sure that that doesn't happen. Your Excellency, the fourth directive that you gave was ensuring financial sustainability. Currently, we've done some computations and estimates, and we know that the total cost of maintaining a patient on ARVs, including monitoring them for care, is about 700,000 shillings for a year. If you took only the pill, it's much lower. It's about 250,000. But when you take all the costs around, it's about 700,000. So if we were to put all the 1.4 million Ugandans on ART, we need close to 1 trillion shillings. It's about 980 billion shillings to sustain that annual treatment. And we've used that computation because we know that 95% of patients are on first line. We have 3.9% on second line and 0.1% on third line. And Your Excellency, the cause for going on either second line or third line is when the medication, either because of non-adherence, it will fail, the organism will develop resistance, and it will fail to work, and those are the ones who are shifted on second or third line. So Your Excellency, currently government is meeting a portion of this. Our contribution of the budget is about 150 billion every year dedicated to ARVs alone, and we are looking at having this increased. The minister is leading that discussion with her colleagues, and I'm sure she will report to you at an appropriate time. Your Excellency, the last directive that you gave us was ensuring institutional effectiveness for a well-coordinated multi-sectoral response. And Your Excellency, we've grouped stakeholders into similar groups. We have 12 of them. We call them the self-coordinating entities. The ministries, departments, and agencies have their secretariat at Office of the President. We have the local governments under the decentralized response. We have Parliament. Your Excellency, we've received a lot of support from Parliament ever since you issued these directives. They have been part of the rollout, and they have supported this all the way. We have private sector, we have media, and in each of these entities, we ensure that there is an HIV focal person, there is a committee, there is an action plan that they use, and that they are always addressing the risks and issues that come up. So Your Excellency, as I move towards the conclusion of the report, our fight against HIV and AIDS has been largely successful because of the multi-sector approach, which you initiated and led. In fact, I've always thought that one of those things that should be patented is probably the multi-sectoral approach, because the rest of the world learned from us here in Uganda. Your Excellency, one of the other areas that remain a challenge is stigma and discrimination, and it's one of the reasons that we see patients either delayed to come to the health facilities, or when they come, sometimes they drop out, or those who are in treatment, they do it in secrecy. They are not sharing information with either their partners, spouses, or family members. So as Uganda AIDS Commission, again, we worked with partners. We developed a national policy guideline on ending stigma and discrimination. We've disseminated this countrywide amongst the districts, and we are continuing to ensure that we sensitize people as much as possible so that we can end stigma and discrimination. In conclusion, Your Excellency, I'd like to thank you for your exceptional leadership rendered to the HIV and AIDS response over the last 40 years. I'd like to thank our esteemed AIDS development partners for working with us this journey, for the support, financial and technical. I'd like to thank civil society, people living with HIV, and all stakeholders. The young people, Your Excellency, have come up and they are with us, so I would like to thank the young people. They are vibrant, they are demanding for the space to contribute, and we are ensuring that they are part of our conversation. I have one last request, Your Excellency. I'd like you to urge leaders at all levels to continue to giving out the HIV message, to urge parents to be good role models and continue to cater for and give information to their children, and it's only that way that we shall defeat AIDS as a public health threat by 2030. Your Excellency, I thank you for this opportunity and for your kind attention.
Thank you so much, Director General, for your remarks. I'm sure with everything that you have just told us, we are on the right track to ending inequalities among adolescent girls, women, and boys. Next, we've got a statement from the Interreligious Council, and it will be presented by our Lord Bishop, North Kigezi Diocese, Bishop Tugume. You're most welcome. You can come and present the statement. Thank you. As the bishop is coming, our discontent couple, please be ready. You will be the next after our bishop. Thank you.
You deliver this. Yeah. The president got his. Yeah. Maybe you raise a little bit. Your Excellency, the President of the Republic of Uganda, Your Excellency, the Vice President, present, Honorable Ministers, present, Your Excellencies, the Ambassadors, present, Honorable Members of Parliament, the Resident District Commissioner, the District Chairperson, LC5, the Chief Administrator Officer, development partners, esteemed senior religious leaders, invited guests, distinguished ladies and gentlemen. I bring you greetings, Your Excellency, from the Interreligious Council of Uganda, and I greet you all in the name of our God Almighty. Today, December the 1st, 2022, we join the government of Uganda and the rest of the world to commemorate World AIDS Day under the theme, Ending Inequalities Among Adolescent Girls, Young Women and Boys. This day gives us an opportunity to pause and reflect on our lives lost, on the lives lost to HIV/AIDS. How far we've come in the fight against this virus, and what we need to do to ensure an AIDS-free future generation. We also take this day, Your Excellency, to raise awareness and recommitment to a faithful and dedicated response. As religious leaders, we want to remind Ugandans that this World AIDS Day is marked while we are still under the threat of Ebola, a pandemic in our country, which, if not adequately addressed, has the potential to exacerbate gaping economic inequalities that may affect us access to education, health care, and affect quality of life through stunted livelihoods. Similarly, let us also not forget the intersectionality of gender-based violence and HIV spread. As World AIDS Day falls within the 16 days of activism against GBV, gender-based violence, which affects all genders, further exacerbates vulnerabilities that increase the risk of infection of HIV. To date, while the world has the means to overcome HIV/AIDS structural inequalities, continue to make it difficult to proven solutions for prevention and treatment from being effectively implemented. This year's theme recognizes and reminds us that there are inequalities in the way we are responding to AIDS. This calls for all of us to work towards ending these inequalities because they are a threat to human and ecological life well-being. Your Excellency, viewed all this from the perspective of HIV/AIDS, we have learned that inequalities take social, economic, and structural forms. Therefore, we take note that persistent inequalities between adolescent girls, young women, and boys can significantly weaken efforts to curb the spread of HIV/AIDS and increase vulnerability. We therefore call upon all stakeholders present here to address the social systematic discrimination that is entrenched in almost all our societal structures. We believe that discrimination denies those living with HIV a fair chance in life as they perpetually struggle with a combination of shame, blame, isolation, rejection, and fear of death. Fellow Ugandans, and through Your Excellency, one of the primary tenets of Interreligious Council of Uganda is the recognition of fair access to the goods and of the earth and the provision of basic needs for all, including health for the Ugandan. We want, therefore, every person, whether adolescent girls, young women, or young boys, in rural or urban settings, should have access to prevent treatment, care, and support, irrespective of their gender, race, or religion. We cannot talk of mercy, compassion, and social justice when there are millions of people living with HIV/AIDS in the world, of which majority of women, men, and children are almost forgotten and face inequality in treatment, access to medical care, dignified existence. We therefore call for a just world that practices equality without leaving anyone behind. Your Excellency, over the last 2 decades, we, the religious leaders under the Interreligious Council of Uganda, have strengthened our mission to accompany those infected and affected by HIV/AIDS through an integrated, holistic approach to AIDS in order to eliminate the economic, social inequalities that they face in all spheres of life. We strongly believe that inequalities that they face in all spheres of life. We strongly believe that ending AIDS as a public health threat is not just medical care, but ensure that we look to those infected and affected holistically. How will their lives be like if they cannot find employment while they are adjusting to medications? If they cannot find access to health and social care? Therefore, while inequalities continue to contribute to the spread of HIV/AIDS, we call upon the government, Your Excellency, and partners to eliminate financial and other barriers to health care, increase investment in order to achieve universal health care coverage for everyone, everywhere, and this will consequently ensure equal access to HIV prevention, testing, treatment, and care for all. In conclusion, Your Excellency, we appeal to all leaders, women and men of goodwill in positions of leadership, whether government, civil society, organizations, and religious leaders, to work towards the defeat of enemies of human life, including HIV, stroke, AIDS, and other vexing diseases. We thank you for the efforts you've taken, Your Excellency, to combat most of these pandemics, including HIV, AIDS, Ebola, and the pandemic that has been threatening all our lives here. And above it all, Lord, with Your Excellency, we thank you for the initiatives taken. We call upon partners and leaders and women to boldly recognize and address the inequalities which are holding back our progress in ending AIDS as a public health threat. There is need to ensure equal access to essential HIV and AIDS services, particularly for adolescent girls, women, and boys, striving for the highest possible standard of health for all people, giving special attention to the needs of those at greatest risk of poor health based on social conditions. If we become complacent in our responses, the HIV/AIDS pandemic will win the race. So I want to call upon you, and particularly the religious leaders, that more effort is needed wherever you go, at whichever altar, and whenever you get the chance to address this. Finally, we pray that those living and suffering who are affected with HIV and AIDS, and for their loved ones, that the Lord will take care of them, that the support from society and our government will be an encouragement, fighting injustice, inequalities, stigma, and discrimination. And all this is said for God and our country, Uganda. Thank you, Your Excellency.
Thank you, my Lord Bishop, for your remarks. Your Excellency, with me I have a couple who have a testimony about their HIV positive status, and I would like them to present, and we listen to this testimony, because I believe that living with HIV is no longer a shame or something to worry about, because we have people here to tell us the story. We also have young people who will be also telling us their story today about how they are coping up with living with HIV. Twabachira, you can take over.
amazina numanyeta Julius Makaiku kandi ndiga Masya Munyakajeme. Enkumi ibiri na mukaga enkumi ibiri nena nkaferwa mukazi. Enkumi ibiri na mukaga natasi mucyara wanje ogo. Kandi ahito asariremu tuzo mutaso tuzo kwekebeza. Kutwayekebize na yesanga nyonyi nakakoko. Umucyara wanje atakine. Kandi aho bakansara bakatwegesa batusomesa bajya mu menkozi sekondomu kandi nanye bantambazwa yera vizi. Nagumera na mukazi yagumana mpabura ngumera je kandi tinyine shonga. Umuryecho twikirizana bagumana batusomesa twikirizana kuba hamwe. Twatura hamwe umwirobwe twazararama abana babiri. Umwe ashikire atembere cyamusanju kano ndijo agira mu cyakashatu. Twatura hamwe bagumana batwegesa batusomesa bajya tuze umubina twakoretse ibina ikibakweta tumurizane group kandi ekimbasise kuyamwe sente nkazeguza kagumana insashara nzigararayo nkiyamwe bintu nkiyamwente nkiyamwe mbuzi kandi umucyara kagumana mpabura numureba okutukusha bweni ninsima His Excellency President witu omurungi webara kutugira okwe umahanga ukatunywanira ukaturetarayo obuhwezi webare munonga ninsima abazungu na munonga abamerika okutuhereza sente bakatuhereza sente bakaguramo imbazi ekaguma tugirya kandi tukakira ninsima owatandikira kitongore cya taso kandi owakitangije mu ihanga ryona nayebare munonga aho nondu kusimira na taso yarukungire eyibasise guma netweta netusomesa netugambira myoga kandi eresere no mbazi omusya oguba kuhereza umucyara wanje nguntaka muturira kakoko wenaho nihondu kuhigira abantu mwene nimba saba nguwako barinkanye aina kakoko mugenzi watakine arebeke nguti yakamuturira kandi yagira okwerinda aho nukusimira na chairman RC5 witu warkungire okuguma notereza umwanya tukakikiramu tukekunda kandi ukatahabura webare munonga wagumiho ninsima umucyara wanje oguma nampabura akanyigambira ngu umiro mbazi kandi akaguma nampabura okusomesa abana banje ngaguma nimbasomesa nko kunabagambira hati umwe naza umusiniya undi atembere cyamushanje nayebare munonga umucyara webare ninsima nimpabura intero maranga abantu abarya nangwa n'abarya heru mwekebeze orasanje ina kakoko bamuragurure ari amira yaravizi kandi akiri kandi atakaturro ndijo mwebare munonga mwebare kumpurikiza nasigara Julius Makaiku.
Your Excellency, the President of the Republic of Uganda, Her Excellency, the Vice President of the Republic of Uganda, and all protocol observed, I bring you warm greetings on behalf of the young people. My name is Emojel Trevor, a young person born and living with HIV, and I'm also the reigning Mr. Y+ Uganda 2022-2023. It's an utmost honor for me here today to be presenting the AIDS memoir on behalf of the young people. Yes, so Ministry of Health in collaboration with partners organized a pre-World AIDS Day conference for adolescents and young people living with HIV with the main objective of capturing the voices of all adolescents and young people regarding the different inequalities they face in the HIV response in the country. We, as young people living with HIV, continue to bear the burden of the HIV and AIDS epidemic in our country. Except stigma and discrimination, we also go through gender-based violence, early child marriages, and all forms of violence. So as young people, we are presenting this, first of all, to appreciate the government for the work they have already done, but also to pledge our resolutions as young people that we request can be done to support young people. Linking and inclusion of networks of adolescent girls and young people affected and living with HIV to government socio-economic projects such as the parish development model, and intentional inclusion into government systems, including national policies and budgets to curb adolescent girls and young women economic and education exclusion. We also call upon government to put in place stringent laws to curb gender-based violence that exposes young people to new infections, to new HIV infections. We also call upon for the intensification and strengthening of male involvement strategies and interventions in the HIV response, particularly targeted towards engaging young men and boys. And then we also call upon for strengthening the follow-up and retention for children and adolescents living with HIV if we are to reach the third 95 as a country. Very lastly, as I conclude, young people also urge that we are increasingly engaged in leadership spaces such that we can be able to have our voices heard and our ideas considered in the decision-making processes of our programs. So this is a call to us all to consider young people and give them opportunities. For us, we believe this is a prudent effort that makes young people not only empowered, but also prepared to handle their future responsibly. Thank you so much for listening to me. I remain Imojel Trevor for God and my country. Thank you.
Thank you very much, Your Excellency, for giving us all this time. I want to remind those who are going to follow that we need to be very brief because there are many other Ugandans, about 44 million, who are waiting for His Excellency for his services. Your Excellency, I want to recognize other development partners who are here with us. The Minister of Energy and Mineral Development is here with us. The Uganda Revenue Authority, Your Excellency, is here with us. The Minister of Local Government, the UPDF, the private sector. We have Uganda Craze and Dot Services Limited. They are here with us, Your Excellency. I also want to recognize USAID local partners, health in services in Ichigezi, and that is JCRC. USAID Rights Southwest, which is operating under EGPAF, and USAID LSDA, which is implementing through UPMB. They are all here and they have supported us in HIV/AIDS. Kindly, our guests, you can clap for them. The next speaker, Your Excellency, will be, shall have remarks from the UN Resident Coordinator. I request you use that microphone in front of you and address us. Thank you.
Thank you. Your Excellency, the President of the Republic of Uganda, Your Excellency, the Vice President, and in the interest of time, I will recognize all the other established protocols. On behalf of the United Nations in Uganda, I'm really happy to join you today as we commemorate World AIDS Day. This day has been celebrated since the 1st of December 1988, making it our 34th World AIDS Day. Your Excellency, your leadership in the HIV response is acknowledged all over the world. You were the first leader in the world to recognize that the threat of HIV needed political leadership. Therefore, 30 years ago, you created the first AIDS commission in the world. Uganda also supported a vibrant civil society movement led by people living with HIV. That movement has expanded beyond HIV and has also engaged in emerging epidemics such as COVID-19 and Ebola. Your Excellency, we honor and applaud you for that leadership. We are 8 years to our goal of ending AIDS as a public health threat and to ending gender inequality by 2030. We congratulate Uganda for the significant strides made. Uganda is among 10 countries in Africa that were very close to achieving the UNAIDS 90-90-90 HIV treatment and testing targets in 2020. So all the data has been moving in the right direction. We appreciate your steadfast leadership in launching the Presidential Fast Track Initiative for ending AIDS by 2030 that helped to refocus the national response against HIV. The global theme for World AIDS Day this year, as has already been mentioned, is Equalize, reminding us that even as we celebrate, there are many who are still left behind, including children, adolescent girls, and young women, people living with disabilities, and other population groups. We must equalize and ensure that these vulnerable groups have access to prevention, treatment, and care services of good quality and attain their right to health. Our data tells the story that despite the immense leadership and progress, the best science, the best tools, a well-financed response, we are still falling short. Uganda is losing 7,000 people each year to AIDS-related deaths. Interestingly, most of them men. And the rates of new HIV infections remains concerningly high among key groups, and has been mentioned, including adolescent girls and young women. In the Eastern and Southern African region alone, we report 3,200 new infections each week among adolescent girls and young women. Importantly, there is a significant difference between infection among young girls and boys of the same age group. Young girls in Uganda are 4 times more likely to be infected than young boys. It is important, as we heard earlier, that we provide age-appropriate sexuality education for children in and outside of schools. We must address HIV/AIDS-related information gaps and enhance our protection measures for young people. Young people nowadays face incredible pressures from their peers and social media to engage in early sexual activity, which exposes them to HIV/AIDS and other sexually transmitted infections. The interplay between HIV, gender inequalities, and SGBV, particularly among adolescent girls and young women, is recognized within the Global AIDS Strategy and High-Level Political Declaration on HIV. Girls and young women remain disproportionately affected to HIV and poverty. And I guess the reason for us repeating these same information over and over and over again is because they're so important. Evidence and practice at field level have demonstrated that addressing financial stress among young women living with HIV and keeping girls in school are relief strategies in alleviating the direct and indirect effect of HIV on women and girls and their immediate households. An example that I came across is that the Karamoja Economic Empowerment Project 2016-2020, which was implemented by one of my UN family members, UN Women, with support from Ireland. It aimed at economically empowering young women and adolescent girls living with HIV to improve their quality of life through social asset building. The evaluation of that project showed that these beneficiaries were better to ably cope with HIV illness, including accessing treatment, and that they were more open about their status. They received greater peer-to-peer support, expert client counseling, and positive living messaging. The Enterprise Development Assistant Group approach really enabled them to share their personal stories, build hope, and dispel stigma, and positively influence their community's perception. So perhaps this is a component that we can more deliberately add in all the various government social action funds being implemented in the country. The closure of schools, of course, due to COVID-19 was very difficult. We know that the longer young people stay in school and complete school, the less chances of registering teenage pregnancies and HIV infections and other sexual-related abuses, and also, in the long run, reducing poverty levels. In response to these challenges, the UN launched the Education Plus initiative. The Plus agenda ensures that in addition to returning and retaining girls in school, that these girls also get access to sexuality education, that they are more free from gender-based violence, and that they have more access from school to work transitions for their economic security and autonomy. As we respond to the several challenges that we face globally and nationally, and many of them have already been mentioned: COVID-19, extreme weather events, the Russo-Ukrainian war, refugee influxes, more recently Ebola, it is important to recognize that we still have HIV/AIDS with us. And the Director General of the Uganda AIDS Commission mentioned some of the innovative ways that we're ensuring that this population continues to get service. I guess the call is just to make sure we keep pushing that. So regardless of what challenges we're facing, we never forget this important group. And on that note, I call upon all of us to redouble our efforts to ensure that the gains made in the HIV response are not lost due to new challenges. This includes addressing the inequalities that prevent people from receiving HIV prevention, testing, and treatment services. So in renewed push for HIV prevention by scaling up implementation of prevention projects so that innovations such as pre-exposure, prophylaxis, and long-acting injectables become much more accessible, especially to vulnerable groups. That we sustain and expand progress on treatment to reach those who are not being treated. These are mostly men, children, and young people who do not know their HIV status. That we support and effectively resource community-led responses to make them friendlier and more operational. And that substantially we increase the financing to sustain the gains made in the HIV response. Allow me to finish by reiterating that really we can end AIDS if, of course, we address some of these inequalities. And I really look forward to our collective success along these lines. And thank you again, Mr. President, for your leadership in this area.
Thank you so much. That was the UN resident. Next on our program to give remarks will be the Ambassador of the US government. I invite you, sir, Your Excellency, to come and give your remarks.
Thank you. Your Excellency, the President of the Republic of Uganda and Vice President, and in the interest of time, all protocols observed. It's my pleasure to be here today with all of you as we commemorate World AIDS Day 2022, and I bring you greetings from Ambassador Natalie E. Brown and the entire team of the U.S. Mission Uganda. And I'm pleased to be also joined here today by representatives from the U.S. Agency for International Development, Centers for Disease Control and Prevention, the PEPFAR program, and also the Department of Defense. All these agencies are in the forefront of the fight against not only HIV and AIDS, but other diseases. And I appreciate all their dedication. The U.S. government's theme for today is putting ourselves to the test, achieving equity to end HIV. And like Uganda's national theme, Equalize, it emphasizes accountability in action, affirming the Biden-Harris administration's dedication to ending HIV, both in the United States and around the globe, through an approach that centers on communities disproportionately affected by the pandemic. This year, we also observe World AIDS Day in the context of other infectious diseases, such as COVID-19, Ebola, and Mpox, which have heavily impacted many of those same communities affected by HIV/AIDS. These threats have further exacerbated the fact that our public health response to HIV will require us to address health disparities holistically. This theme also highlights the importance of HIV testing. Those at risk must get tested for HIV, and everyone should know their status. No matter what the result, people should be connected with the necessary HIV prevention and treatment services, including strategies to address the structural and social barriers to health. I call upon the country's leadership to add equity to accountability, transparency, and impact as a guiding pillar for HIV programs, as well as to prioritize work to eliminate the persistent inequalities experienced by children, adolescent girls and young women, and key populations, including sex workers, men who have sex with men, people who inject drugs, and people in confined settings such as prisons. Together, we have made remarkable strides since the first World AIDS Day commemoration 34 years ago. These advances are largely based on the advocacy of people living with HIV, community-based organizations working in areas most affected by HIV, and through collaboration and partnership between governments, public sector partners, multilateral institutions, non-governmental academic, and philanthropic organizations. The U.S. government, through the President's Emergency Plan for AIDS Relief, PEPFAR, is proud to have been on the forefront of advancing HIV epidemic control for nearly 20 years. As the largest commitment by any nation to address a single disease in history, led by the U.S. Department of State in collaboration with 7 other U.S. government partner agencies, PEPFAR's programs have saved more than 21 million lives and has prevented millions of HIV infections and helped countries build a strong foundation to prevent, detect, and respond to other health threats globally, including COVID-19 and Ebola. Yet despite our tremendous progress, our work is not finished. New data from UNAIDS on the global HIV response reveals that during the last 2 years of COVID-19 and other global crises, progress against the HIV pandemic has faltered, resources have shrunk, and millions of lives are at risk as a result. In addition, because of stigma, discrimination, and other structural factors, certain populations and geographic areas continue to bear most of the burden of this disease. We remain deeply committed to ending HIV everywhere by engaging and empowering communities and by ensuring that our programs, research, and policies are informed by the voices of the people most impacted by HIV. This World AIDS Day, we acknowledge that providing equitable access to HIV testing, prevention, care, treatment, and research is key to ending the HIV epidemic. This year represents a pivotal year in PEPFAR as several countries are reaching or approaching the UNAIDS 95-95-95 benchmarks for attaining epidemic control. Uganda must, as a country, ensure that HIV programs address population equity and outstanding barriers that threaten to derail progress to reduce new HIV infections and associated mortality. Uganda must tailor its programs to serve all populations because a focus on equity also means a focus on population groups where our efforts to date have not closed these gaps. As Ambassador Brown mentioned during the National HIV Symposium, it's time for all of us to match our words with actions. But to do so, we must turn the conversation to what we are not talking about and what we are not doing, to acknowledge the things that need to change, and to make a deliberate choice to take action. Our conversation needs to become about conscious decisions, who gets to make them and who doesn't get to make them due to stigma and discrimination driven by a lack of knowledge and understanding. Preventing HIV, knowing your status, and choosing life-saving HIV treatment should be an easy choice for everyone, but for many it's not. Sustaining epidemic control will require more robust and efficient systems to allocate and manage limited resources. And that's why this fiscal year, PEPFAR is working across all levels of the health system. At the national level, we will continue prioritizing development of key policies to ensure that programmatic barriers hindering equalities among adolescent girls, young women, and boys are addressed. At the regional level, we will continue to support the Ministry of Health to roll out the regional referral hospital strategy while ensuring the capacity of these regional referral hospitals is built to fully take on core mandates like continuous quality improvement and supportive supervision, in addition to the provision of quality HIV prevention and treatment services. PEPFAR believes that strengthening the regional referral hospitals' technical and organizational capacity is fundamental for supporting oversight at the decentralized level, especially as we reach epidemic control and start transitioning more responsibility to the government of Uganda. In conclusion, I want to say that together with the government of Uganda and civil society leadership, we've made tremendous progress on the HIV response. However, the magnitude of sustaining the HIV impact remains high. Uganda still has about 1,000 new infections and 500 deaths every week. This reminds us that in addition to the Presidential Fast Track Initiative, we must recommit and re-energize all sectors of society to center equity within the country's HIV response by ensuring that everyone with HIV and those at risk for infection have access to appropriate HIV testing, treatment, and prevention services. We encourage anyone who does not know their status to get an HIV test today and to help us combat HIV-related stigma. As we work to implement the National HIV/AIDS Strategy, this year's theme reminds us that the time has come to act, and for all of us to put ourselves to the test of ending HIV by supporting health equity, sustainability, public health systems and security, respectful partnerships and science in the context of community leadership, innovation, and leading with data. And more importantly, by amplifying the voices and strategic priorities of people living with HIV. And I just want to conclude by thanking the Ugandans living with HIV who stepped forward today and courageously shared their stories. I was very touched by it and very inspired. So thank you very much for that. And thank you, Your Excellency.
Thank you very much, Your Excellency, the Ambassador of the U.S. government, for your good speech. Another clap for him for his very good message. On the program next is the chairperson of the Parliamentary Forum on HIV/AIDS. I want to request you to come with the rest of the MPs for introduction. Yes, you reintroduce the members of parliament. The time is not enough. Maybe you will ask them to stand up for recognition. So as you come, Your Excellency, allow me to recognize Uganda AIDS Commission for the great contribution they have made. They are the ones who have funded this activity, and I want to request all the entire guests here to clap for Uganda AIDS Commission for today's function. I also want to recognize the chairman of Kanungu District. LC5 Kanungu is here with us. You are most welcome. The RDC in Tungamo is here with us, Your Excellency. The RDC of Mitoma is here. The Deputy RDC Mitoma is here. Deputy RDC Kanungu is also here. And Madam Jole Masheija, who is the chairperson of Women Council for Kunjiri District. And Your Excellency, recently when you were commissioning a factory in Kampala, you talked of a younger Muchiga boy who had invented that actually hydrogen can be used as a fuel. That is now, he has grown up. He's called the engineer Mukunzi Frank, and he's here with us. If you are close, maybe you can stand up for recognition. Where is the engineer? Engineer, yes, he's right over there. He's the one who invented that hydrogen can be used as a fuel. Honorable Stephen.
Yes. Yeah, thank you so much, Master of Ceremonies. Your Excellency, the President of the Republic of Uganda, General Yoweri Kaguta Museveni, Your Excellency, the Vice President, the Honorable Ministers, Members of Parliament, UN agencies, the district chairpersons, people living with HIV in Uganda, all invited guests, ladies and gentlemen. Your Excellency, I'm Chisa Stephen Bakubalwayo, the Member of Parliament of Luuka South, and by the grace of God, I'm the Deputy Chairperson of the Committee on HIV, AIDS, and related matters in the Parliament of Uganda. Your Excellency, before I proceed to make my remarks, allow me to introduce the members of Parliament on the Committee on HIV, AIDS, who are here to grace this occasion. Your Excellency, I have Honorable Durewaru Jennifer, Woman MP, Maracha District. Your Excellency, I have Honorable Kakembo Mike Mbwa Tekamwa, the Member of Parliament for Entebbe Municipality, is the opposition representative on the Committee of HIV/AIDS. Your Excellency, next is the Honorable Sendaura Christine Bukenya, the District Chairperson, Chankwanzi District. Woman MP, Chankwanzi District. Your Excellency, we have Honorable Komakech Christopher, Aru County MP. Your Excellency, we have Honorable Dr. Lieutenant Colonel Aranyo Jennifer, the UPDF representative. And Your Excellency, she is also our whip on the committee. Your Excellency, I want to introduce Honorable Wanyama Mike, MP Namayingo South. Your Excellency, allow me to introduce Bulambuli County. Your Excellency, allow me to introduce Honorable Avako Melissa Gure, Woman MP, Yumbe District. And finally, Your Excellency, allow me to introduce Honorable Achib Agnes, the District Woman MP, Nebi District. Your Excellency, the committee is made up of 38 people. Some of the members of the committee are in Juba, South Sudan, for the East African Interparliamentary Games, including the chairperson of the committee, Honorable Sarah Netalisiri. Thank you so much, honorable members. You can take your seats. Your Excellency, the President of the Republic of Uganda, fellow countrymen and women, today we join the rest of the world to commemorate the World AIDS Day, to especially take stock of the milestones achieved since the start of the fight more than 4 decades ago, with the theme as stated. The theme reflects a realistic approach needed to focus on in ending AIDS in Uganda as a public health threat by 2030. Your Excellency, allow me make 2 observations and 2 appeals, Your Excellency. Observation number 1, Your Excellency, we have observed that the country had made significant progress in the fight against HIV/AIDS, as already mentioned by the Director General. Your Excellency, we want to thank you for being a champion of this particular achievement. Your Excellency, in spite of such great achievement, in 2021, at the peak of the COVID-19, new infections shot up from 38,000 to 54,000, mainly because the attention was on COVID. This therefore taught us that we need to include HIV messages alongside the COVID-19 and the other health-related matters to address the dual challenge concurrently. Your Excellency, allow me to make the appeal as follows. Your Excellency, you instructed the country in 2017 to implement the 5 pillars mentioned by the Director General. Among the most notable is number 4 of ensuring financial sustainability for the HIV response. The Committee on HIV has observed, Your Excellency, that in 2014, Parliament enacted the HIV/AIDS Prevention and Control Act, and the Ministry of Health developed regulations for the operationalization of the AIDS Trust Fund. Therefore, on behalf of Parliament, the Committee on HIV/AIDS and related matters is appealing to you, Your Excellency, to prevail over the Ministries of Finance, Planning and Economic Development, so that, and that of Health, to fast track the operationalization of the AIDS Trust Fund so that there is a sustainable HIV response in Uganda. Appeal number 2, Your Excellency, I want to call upon the younger people to live their lives responsibly and respectfully so that they don't contract the HIV virus. Adolescent girls, younger women and boys, your life is your future. As the government secures your future, guard yourself jealously against HIV. Your Excellency, appeal number 3, I want to call upon the parents to pay keen attention and adequately talk to the children and be champion of behavioral change campaign, starting with your households and general communities. Your Excellency, the most notable challenge we have now in fighting HIV is not having responsible parenting. Your Excellency, the government has been teaching Ugandans about patriotism. I want to appeal to the government, Your Excellency, so that you equally teach Ugandans to have responsible parenting. Finally, Your Excellency, I want to appeal to all stakeholders to have a clear focus and make efforts on implementing the presidential fast-track objectives and mainstream HIV in all the government programs towards achieving epidemic control in Uganda by 2030. As I end, Your Excellency, allow me to take this opportunity, 1, to thank you, Your Excellency, the President of the Republic of Uganda, for championing the fight against HIV and for setting the pace of the nations across the world. Your Excellency, the story of fighting HIV/AIDS in Uganda cannot be complete without mentioning you and your name. We want to thank you so much. Your Excellency, allow me also to recognize the contribution our AIDS development partners and call upon them to provide more support as Uganda runs the last mile of ending HIV/AIDS by 2030. Your Excellency, we have noted that in the last 3 years, we have been having a declining donor support towards HIV response. And the Director General, Uganda AIDS Commission, has also declared the low funding to HIV response. So I want to request them to continue supporting and the government of Uganda. Finally, I want to thank the AIDS Commission for showing exemplary leadership in coordinating HIV and AIDS response in the country. Your Excellency, the President, as the Parliament, we are very grateful to Uganda AIDS Commission for the commendable work they are doing across the country and for holding our flag high in the continent. I want to thank you, Your Excellency, for listening to me, for God and my country.
Thank you very much, my honorable colleague and member of Parliament and chairperson, Parliamentary HIV/AIDS Forum. Your Excellency, allow me to recognize the following who are with us. Professor Vina Dinantudia, former chairperson, Uganda AIDS Commission, is here with us. Clap for him. The chairman, CCM Board of the Global Fund, is here with us. Your Excellency, we have board members of the Global Fund who are also here with us. Kindly stand up for recognition. We have the UNAIDS Executive Director, Jackie Makoka. She's here with us. Kindly receive her. We have the National Drug Authority, Haji Jamir Rutakome, and board members, Mr. Chiza Kenneth, who is also the regional manager of the Southwestern. We also, with us, Your Excellency, we have the USAID Social and Behavioral Change Activity. They are here with us and they have supported us. Your Excellency, allow me, ekikankigambe omurukiga konka nsime abantu barukungiri ahabwe obuhagizi kandi niyenda ngu nyakire omwami byaruhanga rwakana kuri system chairman w'abashubuzi barukungiri byona kandi nakolesa mani mingi munonga omwami Kibika Ambrose na wadyaha kandi n'umuhagizi w'amani mbweno motero mungaro. Next on the program, twakurikiza Honorable Hanifa Kahoya, Minister of State for Health, for General Duties. Kandi abanyarukunjiro mu mutero mungaro munonga abwo kubirwariro ryitu General Hospital niye rukwenda kuruga kandi bali kwatise emikono ebiri kureba ngo ryabaho. Your Excellency, nyowe nko mushaho niyenda kongera hiraka rya chairman kumanyisa ngo General Hospital yarukunjiri buzimani tugiyetaga munonga when we make referrals kuturikora referrals, Your Excellency, kuturikora referrals tubastaka n'abaturage barukunjiri ngweni ikintu kirwa recho. Your Excellency, tuchandolinge kibe kurungi. Honorable Minister, you are most welcome.
Your Excellency, the President of the Republic of Uganda, Your Excellency, the Vice President of the Republic of Uganda, Honorable Ministers, Honorable Members of Parliament, Your Excellencies, the ambassadors present here, Your Excellencies, the country representatives, development partners, all distinguished guests, our leaders, local government from all the areas here, the Chairman Uganda AIDS Commission, the board, and the entire team, officials from the ministry, and the entire health fraternity, the media, ladies and gentlemen, good afternoon. Your Excellency, I want to join the people, and more so from this district of Urukunjiri, a district where I was born here in Chinyasano some few years back.
And I want to say that this is where I originated from until I moved to where I am in Uganda. Your Excellency, I want to welcome you most warmly for having accepted to participate, to be here with all the Ugandans as we join the whole world on today's commemoration of the 2022 World AIDS Day. Your Excellency, you are most welcome. Abanyarukunjiri mwena, abantu mwena bari haniya, nitwenda nkutwebaza His Excellency President Museveni, abo kwija akayikiriza kutwegeitaho obwe nitukuza orunaku rwaitu orwa World AIDS Day. Okureba itu rugire, aitu aika, aho turi, nankahi aitukuza. Mwebare mnonga, konka mwongere mwe engaro nyingi nkesi twabire ntera kare. Your Excellency, I joined the people of Uganda and the global community to commemorate the 2022 World AIDS Day. And on this day, Your Excellency, we reflect on the journey we have walked together, celebrate our achievements, and critically think about the challenges we face in responding to HIV/AIDS and epidemic in Uganda, most of which, Your Excellency, has been clearly put forward. On this day, Your Excellency, we also unite to continue our collective solidarity with the people living with and affected by HIV/AIDS, and we also remember all who have died before of the AIDS scourge. The Minister of Health, Your Excellency, embraces the 2022 World AIDS Day, of which theme is Equalize, and a local theme ending inequalities among our adolescent girls, young women and boys. Your Excellency, the two themes call upon each of us to address the inequity slowing progress in ending AIDS. I congratulate all of you who are working and supporting the government of Uganda in addressing this disease. We have made significant progress in our efforts to control HIV epidemic, and we are doing so much with collaboration of Uganda AIDS Commission, our development partners, as they have said. And two, we are doing all that is possible to ensure that despite what we have been going through and with competing health emergencies like COVID-19 and Ebola, we still strive to ensure to see the reduction, prevention, and management of HIV/AIDS in Uganda. Your Excellency, however, as you have heard from the previous speakers, HIV/AIDS is still a significant concern for this country. It's still a public health concern. Your Excellency, according to recent data, 5.5% of all Ugandans aged 15 to 49 years have HIV/AIDS. And with this, the biggest percentage is the women. Your Excellency, despite the slight improvements, as we have said and heard from the Executive Director, Uganda AIDS Commission, about 1.42 million adults and children are living with HIV. Adults aged 15 years and above account for 93% of this number, Your Excellency. And of this number, 60% are women. In the towns and cities of Uganda, Your Excellency, 7.1% of the adults above 15 years have HIV/AIDS, compared to the same age group in villages, which is at 5.2%. Your Excellency, we have made some improvement as observed, and according to the current status, the Ugandan adults with HIV/AIDS have reduced from the last 5 years from 6% to 5%. It's a very slight improvement, but we think that with all together and working as one, we shall have to reduce the numbers. We continue to see decline in new HIV infections and AIDS-related deaths, with a drop from around 20,000 deaths in 2020, 300,000 in 2021. Your Excellency the President, the number of the very people who and working with the Uganda AIDS Commission and all our development partners. We have made some progress, I've said. We have put in place a number of programs, all intended to educate the public, to ensure that we disseminate information to the public about HIV/AIDS prevention, care, and treatment. We have put in place many flexible management and treatment, which are all intended for service delivery to our people. Your Excellency, many programs that are in place, the Executive Director of Uganda AIDS Commission has elaborated them. Some of us, a risk communication program, which program the ministry continues to emphasize on HIV prevention and its practices. The condom use, Your Excellency, and we want to thank the Global Fund, USAID, UNFPA, and other partners who have supported the ministry to ensure that this program is a success, and we have distributed more than 250 million condoms, and we still call upon the young generations and everybody that we should have to continue and consistently collect and ensure the use of this. Your Excellency, the Ministry of Health, to ensure that your 5 directives, the Uganda AIDS Commission, as far as implementation is confirmed, the Minister of Health has got its own person member on this committee, none other than myself before you as the Vice Chairperson. And I want to add my voice to thank the Uganda AIDS Commission for a good job well done, Your Excellency. I have sat with them, we have moved together. The achievements we are seeing now is none other than your wise leadership, and everybody is proud of you and the political will. We thank you so much. Your Excellency, HIV/AIDS prevention services as a ministry, we are intensifying them. The program on safe male circumcision, Your Excellency, as one of our partners has said, especially in the Karamoja region, is one program that we are proud of that is being embraced. Your Excellency, we want to thank our partners from the PFR and the United Nations agencies who have continued to provide safe male circumcision, which is critical in the elimination for HIV control and management. Your Excellency, prevention of mother-child transmission, Executive Director of Uganda AIDS Commission has said much on it, and as a ministry and with all the partners, donations, and their support, we are doing a commendable job. Your Excellency, HIV care and treatment program is also one of the programs that is ongoing. Strategic information dissemination also is being emphasized. Your Excellency, in conclusion, the Ministry of Health is very grateful to the partnerships that have supported the HIV/AIDS response in Uganda. I thank the United States government for their response towards the HIV elimination and control as a ministry. Your Excellency, we are very grateful. We are grateful for the PPFA and Global Fund, the United Nations, World Health Organizations, UNICEF, Uganda, the UN Women and UNFPA. Your Excellency, the development partners have tremendously supported the Ministry of Health. They have supported Uganda AIDS Commission to ensure on the reduction of the HIV/AIDS. Finally, I wish to extend our sincere appreciation, Your Excellency, to you in particular, having been that you are at the forefront, you are the champion, and up to this day, as you embrace this World AIDS Day, that you have made tremendous achievements where we are going, especially your visionary leadership, your focus, and where all Ugandans have embraced that your style of work, your style of guidance, and this is why our ministry as Health with our partners, we still look forward that though the figures are still not all that, they are still alarming, Your Excellency, with your guidance We look forward to working together to ensure the reduction and the control of HIV/AIDS with all other pandemics. We thank you for the support and the help and the political guidance you have always given my ministry, and I say all this for God and my country. Thank you, Excellency.
Thank you very much, Honorable Minister. Your Excellency, amidst us, we have the resident judge for Rukungiri Circuit, Justice Tom Chemutai. Kindly stand up for recognition. And Your Excellency, nitukusima mnonga kabanya Rukungiri, go to the High Court. We are now safe. Let me invite our General Jim Muhezi, the Minister for Security, to give your brief remarks, and you will help us after your remarks. You will invite the Minister for Presidency, and the Minister for Presidency will invite the Vice President. Members, abajenyi bitu mwe n'abanyarukungiri twino mugisha muhango kutaya isa President na Vice President at the same time. Mukiterero mu ngaro ejo nenema. Mwebale muno.
Your Excellency, the President of the Republic of Uganda, General Yoweri Kaguta Museveni, Her Excellency, the Vice President of Uganda, Honorable Ministers, Honorable Members of Parliament, Your Excellencies, Ambassadors and High Commissioners, and all leaders as previously recognized in the interest of time. Your Excellency, I want to thank you very much for visiting Rukungiri. And I would like to thank your government for bringing this important occasion to Rukungiri district. Kandi ntwenda kukurusya kanche gambo mu ruhororo runyankore rukiga akaruro kahwire mutero mungaro munonga abanyarukungiri nokimanya ngo tukakuho hagize bw'amani kandi nyenda kuhamiza ngo abwemirimo mirunge yoriyo nokora obuhagize buriyo nubugenda nubweyongera koko kuza kureba bwa nyuma ho kake Rukungiri obuzare bwayoneiwe n'ubuhango munonga kandi n'obwakare kandi riyo neza gwaraka mwanya gwayo ogwakare guyabirero. We thank Your Excellency in the fight against the pandemics, starting with HIV/AIDS, as was very well recognized by the UN representative. I remember you came in this very stadium here and you were teaching people that this disease of HIV/AIDS is dangerous, has no cure, but is avoidable. And you graphically explained that we know where the snake is, in that hole, and if you put your finger in that hole, you'll get the problem. And the people recognized it and avoided it. So we thank you very much. And you have done the same in the other pandemics like COVID-19, Ebola. You have been in the forefront in teaching. When you are addressing people, you don't read the statements. No, you teach, you explain, and the people understand. We thank you very, very much. So I don't want to take much time. I have a duty to introduce my colleagues, the ministers. We have here the Minister of Presidency, Honorable Mile Babalanda. We have got Honorable Musasizi Henry, Minister of State for Finance and MP for Rwanda East. We have, whom you have just seen, Honorable Anifa Kawoya, Minister of State, General Duties, Minister of Health, and MP Sembabule. Honorable, we have got Honorable Nyirabashitsi Mateke, the Honorable Minister of State for Youth and Children. We have apologies from Honorable Bahati, David Bahati, who was unable to reach here, but he was also coming here. With those few remarks, I would like to invite my colleague, the Minister for Presidency, Honorable Mile Babalanda, who is in charge of the Uganda AIDS Commission, to give her remarks. Thank you very much.
Your Excellency, President of the Republic of Uganda, Commander-in-Chief of the Armed Forces, and National Chairman of the NRM Party, Retired General Yoweri Kaguta Museveni. Her Excellency, the Vice President of the Republic of Uganda, Retired Major Jessica Alupo Rose Pell, Honorable Cabinet Ministers, Honorable Members of Parliament, members of the Diplomatic Corps, representatives of religious and cultural leaders, the LC5 chairperson and the entire leadership of Rukungiri District, representatives of civil society organizations, representatives of people living with HIV, media fraternity, ladies and gentlemen. Your Excellency, I warmly welcome you to the National Commemoration of the World AIDS Day 2022. I thank Rukungiri District Local Government for hosting this year's commemoration. However, Your Excellency, before I can make my remarks, allow me to thank you for your wise leadership and counsel in the fight against the Ebola challenge, which the country has been dealing with for some time now. If it were not for your effort, Your Excellency, we would right now be in a nationwide lockdown, or we would have lost many Ugandans to the disease. However, it is now coming to 20 days, Your Excellency, and there are no new cases, and we can hold this event in the open in Rukungiri and not scientifically in State House. I therefore commend your great efforts, Your Excellency, and that of the National Task Force on Ebola for this victory. Your Excellency, today, as the world commemorates World AIDS Day, Uganda takes this momentous opportunity to sincerely thank you for your outstanding role in the fight against HIV and AIDS, locally here in Uganda, as well as globally. Your Excellency, since the first case of HIV was diagnosed in Uganda in 1982, you courageously faced the challenge at a time when HIV and AIDS were viewed with a lot of suspicion, fear, and stigma. You led the fight by example. You summoned and prepared all your troops to tackle the fight against this enemy, that was threatening the growth and progress of this country. We therefore celebrate your courage and heroism today, Your Excellency. In 2017, you launched the Presidential Fast Track Initiative to end AIDS as a public health threat in Uganda by 2030. You directed the Uganda AIDS Commission to coordinate the implementation of the Presidential Initiative to end AIDS by 2030. Your Excellency, I am pleased to note that 5 years later, a lot of progress has been achieved, as you have heard from the previous speakers. I take this opportunity to thank the First Lady and Mama, Honorable Janet Kataha Museveni, for her invaluable contribution, particularly in the efforts towards eliminating mother-to-child transmission of HIV. I thank the Ministry of Health, Uganda AIDS Commission, our development partners, Parliament, and all stakeholders who support government in the fight against HIV and AIDS. As you have heard from the report, Your Excellency, we still have unfinished business and a lot of work to ensure that our people do not forget about HIV and AIDS. It is not acceptable for us to continue having over 1,000 people still getting new HIV infections every week, Your Excellency, while still including the newborns. It is even more critical to increase efforts in community awareness and sensitization, especially to ensure that emerging public health emergencies like COVID-19 and Ebola do not undo the gains made in the fight against HIV and AIDS. Your Excellency, some of the efforts made by Office of the President include directing all resident district commissioners to keep promoting the campaign against AIDS by using the government airtime on radios across the entire country. Through the Uganda AIDS Commission, Your Excellency, we are coordinating all ministries, departments, and agencies to mainstream HIV and AIDS in their routine work. I am pleased to report to you, Your Excellency, that about 78 ministries, departments, and agencies are already mainstreaming HIV within their entities, and I get regular reports on their performance. Uganda AIDS Commission also engaged the Secretariat of the Parish Development Model at the Ministry of Local Government to ensure that HIV and AIDS messages are incorporated and relayed to our communities. Your Excellency, I thank you once again for gracing the World AIDS Day commemoration this year. You have consistently demonstrated your commitment towards the presidential initiative to end AIDS by 2030. I thank our development partners and all the stakeholders for the continued support. I thank Rukunjiri District Local Government for hosting this commemoration. I call upon everyone to remain responsible and committed towards ending AIDS in Uganda. It's now my singular honor and privilege to invite Her Excellency, the Vice President of the Republic of Uganda, to address us. Thereafter, she will invite you, Your Excellency. I thank you all for God and my country.
Your Excellency General Yoweri Kaguta Museveni, the President of the Republic of Uganda, colleagues, ministers present, colleagues, members of parliament, excellencies, the ambassadors and heads of the diplomatic corps, religious leaders, let me adopt protocol as articulated by the Master of Ceremonies. Nimbaramusha mwena mwebare kwachira President Omurere Kunjiri mwebare kwashajika NRM na President Museveni kandi na 2026 nimbashaba okuhajira President Museveni. Your Excellency, it is known that you are a champion in the fight against HIV/AIDS and other epidemics, including Ebola and COVID-19. Therefore, there is no better person to address this audience at this time except you. Allow me, therefore, Your Excellency, to take this honor and privilege to invite you to speak to us. The floor is yours, sir.
Okay, thank you, sit down. Thank you, sit down, please. Her Excellency the Vice President, the ministers and members of parliament, members of the diplomatic corps, the district leaders of the government and of the NRM, and all the people who are here. I will speak in the local language, then I will summarize. I think it's better. Ekyokubanza abanyarukungiri ninyenda ko batabaza ku rw'ombuzahe emwabere muzahire mukurikiyeyo okugaruka omuka eka yanyu eryaha eka yanyu nemanyisa NRM. Ekyakabiri ekikwitse ahari mukenenya AIDS ekyokubanza owarinda wakame atumwayagarkamu mwayagarkamu. There is a proverb here which these children have answered. I think it can be summarized as constant vigilance. Constant vigilance, to be vigilant all the time. So when I told them in the local language, they were able to answer back and say, this is the way that we say it here. It's a story of a rabbit which was being hunted and so on. Mbwena hati ekyo nambe walinda wakamagira ata walinda wakamazora mwisho ekya kabiri mureke kuzanisa AIDS mureke kugizanisa ahubwo icyo kubanza abantu basya nibakikwatwa AIDS z'obwahati ababere barije okukira munonga abana bato bakwatwa akakoko okuruga mu bihandiko bya Ministry abantu 1,400 buri mwaka nibakwatwa akakoko aka basya nabwekyo mureke kuzanisa akakoko aka kandi abantu 1,700 buri mwaka nibafa nibaitwa AIDS kyamazima hatwine embazi eyokuhangaza omuntu oyina akakoko nk'oku mwareba abamama babarya egyo embazi ekayamba munonga abantu tubakifa munonga konka embazi egyo nehangaza omuntu aturaho agumaho nagumaho kumara omwanya murengwa nasa kuhangara kushitya obukuru konka sirimu neba ekumugize noguma uri ekimuga torukufa konka noguma uri ekimuga ekyokureberaho okwehangamurra nokumanya okwehangamurra okuza kintu ekyamaani korukwehangamurra wagira otukanza omu mahe nyina akakoko ndi aha mubazi niginywa buri mwanya kanza omu mahe kokuza kukora ebyamahe ebyamaani akakoko nikabaruka norwara ekyo nikimanyisa ngu akakoko kacwa ahabi wakwenzire kukora omu magara gawe tuwafa wahangara wareberera abaana bawe bakora banyeta wareberera ebintu byawe konka kakucwaho ebi wakwenzire kukora ebimwe tuwabasa kubikora ahabwokuba akakoko kakumugize nabwekyo mukimanya ngu ekikuru munonga ekyakukizira obulungi habwokwenda ngu amagara gawe okore byona ebyorikwenda kukora nokwerinda akakoko aka okareka kukwata akakoko rero okabasa kukora ebintu byawe nka Ruhanga etarante ziyakuhaire okushitya obukuru konka kandi aho ninyongeraho ekindi kigambo abanyarwanda nibaremo akantu kake jimu yakibagambira obukoko katandika nkajana bagambira aha ntenjo kayaberi umushoyi no umushono nimugumanya umushono nimugumanya bitaba kubatakimanya nari nyankora umushoyi nimugumanya ekina cyenke bebe kiri obwina bwenke bebe bo buri mwenanga tiriya yera hango mnongo otuno twina tuki nkagenda njo khiyari umushono koko batagira hwire te kuruma mbino umushono uno no fakina gugo tarakumanya ukuza kwata kwato umushono ufakina umushono bakwero bwanyampara bw'umushono ufakina yo abo kubenye ndwara sirimu nendwara tene mani tinka senyiga nangu senyiga koro kushtama n'omuntu wasenyiga omumotoka ningo omukanisa mwashtama hamwe nakuturrabo kwa senyiga nerabo omumbeho omwanya beteji sirimu nebiri yaheri ehunami obone woje kugitahirira mbwe nabo ekyo mureke kuzanisa sirimu abo kuba nubu wakumire mbazi okajimera nko kutukubahabura nohangara n'ikirungi konka n'omuga tokukora byo nibyo wayenze gukora kuba kandi waza mbazi utagihamiraho nofa nicyo wahorana bajya ngo abamoko bakoremwe mbazemwe babatahandi hamiringwe ndijo ekibarema bafu nibo abantu umutwaro gumena kashanju abarufu buri mwaka icyo kubanza akakoko kamuzya yazambaze embaze kamuhangarize koga kwiyahika kandi embaze nayo yagigayaraho ecyarigamu twafurwa abantu nabo cyo akakoko imwabanamwe nyoni nkunda mani abagati inimyaka 58 bete nerizo kwa kureto rwara tukakwatana tushobora kirampa abo kuba korugumana man gawe agarhanga yakwire nigakumara ikiniga icyo urenda gukora cyona uryakikora nabo kini abana nimbeshengereza abatsigazi nempangare muri cyo kutwara utuntuke tukabasisira ecyango kuma magara gawe nijo kushanga amagara gawe gakwereza bingi okukira ututuntu tukubantu batwara tene icyamana icyo kutwara kuza kutamagara gawe umukabi konge cyakana no okubangira abantu baitu abashikirwa akakwatwa akakoko okubabangira to give them solidarity mwino kukikora nakyo cyabo kuba nubara aina akakoko konka kutukumubangira yanywe mbazi atajigayireho nahangara nakwera imirimo ndije konka tari yamana munonga ri yamana kayamahita kugibasa Bitindijo imirimo yaka yo mu office nagikoreye. Nagumaho nahangara okusya ombukuru. Nabwo ekyo kumbe tubentirebe omupapura nayararekeje. Nareba ngurukungiri ato mu Uganda yona ko kumahurura abantu batano harburigana baina kakoko mu Uganda yona konka bakukira obubi ukuba kubi n'abakarangara abantu 16 aharigana baina kakoko. Rukungiri eri omwanya gwe 14 mu Uganda yona abantu 8 baina kakoko aharigana. Kandi rukungiri n'abantu bashomere n'abantu bedini Church of Uganda lyaha Kinyasano Nyakibare lyaha n'abasalamu nabo nkabarebaho n'aba bashyabizira abakuburira abarokore nabo nimbarebamo ataba 8 bargaye. Kandi mureke kwekwatsa ebinabiriya abo kuba ogumushaija wa ekitongore kya sirimu yatandikira ebihandiko arupapuro rwakana omukatabo wako abarukungiri bari omwanya gwe 14 abakarangara nibakwata omwanya gw'okubanza. Konka hariho ebicweka bya Uganda ebiine akakoko abarwaire bake munonga. Twara ekicweka nibakyeta Maracha. Didn't I hear that one of the MPs was coming from Maracha? Come here and they see you. Come forward. Where is she? She's a girl. Stand on the microphone there. Ingonia. Nimuramutse mu rurimi rw'uko tumukuruma nyimu. Ingonia.
Your Excellency Mamuke.
Award 4.
Award 4 to.
Now I see in Maracha yo ombantu igana omuntu omwe nkano nwena kakoko. I am telling these people that while in Rukungiri the AIDS prevalence is 8 people out of 100, in Maracha it is only 1 person out of 100. You tell them what's happening there. What are the Marachas doing about the source of AIDS there?
Your Excellency, thank you so much. We do a lot of sensitization, and our traditional leaders are doing so much.
Traditional. Okusomesa the family upbringing.
Yes, Your Excellency.
Award 4.
Award 4, Your Excellency.
Hatu Omaracha omuntu omwe harigana wenka nuwena kakoko. Oza Individual district tunajata yumbe na marugwara nkaba ukona yino muntu omwe oharigana nwe nakakoko oza kotido n'umuntu omwe tarukwika 0.9% abakoromojo abatashomire n'umuntu omwe takwika karenga abana bakoromojo 0.9%. Kabong 0.7%. Mbwena ho abarukungiri leta yire kitabu yangu abarkwebembera mukakoko these are districts ziri abarkwebembera Karangara abantu 16 harigana Chotera abantu 14 harigana Kabarore abantu 13 harigana Pader abantu 12 harigana Masaka abantu 10 harigana hey 11 Guru abantu 10 Karungu abantu 10 harigana Mbarara abantu 10 harigana Lira abantu 10 harigana Bushenyi abantu 9 harigana Wakiso abantu 9 harigana Kiruhura abantu 9 harigana Lyantonde abantu 8 harigana Rukungiri abantu 8 harigana mbona izinu zebemberezi Dero abantu abatashomire abari inyuma ko kutandikira nkari Bududa abantu babiri harigana Kibuku umuntu omwe harigana Namsindwa umuntu omwe next week harigana Amudat umuntu omwe next week na Kapiripirit umuntu omwe harigana Terego umuntu omwe harigana na Park umuntu omwe Parisa umuntu omwe Maracha umuntu omwe Yumbe umuntu omwe Kotido n'omwe takwika Karenga n'omwe tarukwika Kabong n'omwe takwika na Beratuku n'omwe takwika nabwekyo murekikwe kwatsa egendwara neretwa okwekwatijaga kwata magaraga wijaga aho katware abanye-Uganda bamwe endwara ninke mnonga omuchweka byabo ahandi niho eri higuru nabwekyo nimbashabe ibintu bibiri ekyo kubanza utakarwire utarwara habo kuba kurwara no kwereze mbazi nikitwa habiwa kukozire icyo muzungu arakweta potential icya kabiri kora arware ragusa reka kweshereka kandi kora raguzi ohamira mbazi icya kashatu mureke kweshanya abarwaire aboko no bara arwaire nabaza kuhangara kandi nasa gukora emirimo mingi okwiyeho emike ey'amaani munonga eri kumurema nibyo bintu bishatu. So what I was telling these people is that the best thing for AIDS is prevention. Avoid. And the reason for avoidance being the best solution is that if you get infected, even when we put you on these treatments, there are certain activities which need a lot of physical exertion which you may not manage. Like, for instance, army work, joining the army. Therefore, even when we keep you alive through the ARVs, you will have cut off some of your potential. It will be like a PWD, person with a disability. Nobowa Muga. So that's the main point. That was the first point I was saying in our local language. Secondly, I was telling them that this is very easy to avoid because we no longer have AIDS of accident like we used to have in the past. Because in the past, you could get AIDS through blood transfusion. You could get AIDS through the mother to child. You could get AIDS through unsterilized syringes in the hospital. But all those were eliminated. All those were eliminated by the interventions we did over the time. Therefore, the main source of AIDS now appears to be behavior related, where you do what you shouldn't do, and then you get AIDS. So therefore, I'm determined to insist on this behavior change. And you, the church people, the mosque people, please bring this one out very clear, and the RDCs. Because we don't want to cut on the potential of our children by this problem. Because a PWD, yes, he will live for long, he will do things, but there are certain things he cannot do. That's why we say PWD, person with disability. So this was the point number one. Number two, I was telling them that if you get infected, then get tested, get treatment, and stick to the treatment. And then thirdly, I was telling them that don't discriminate against people who are living with HIV, because they are not a danger to you as long as you relate with them normally, and they can do many, many things of what other people do. Ate kya kabiri, obuna abaninyisha nareba kuri mu rutsindura nkuri y'abana orugashema, nareba rwa mabondo omuruza kajara noshuta na kuno yoguru kuzaka henge, nareba hina abantu abakwingo mbisharra abayine mu emirenzyo abatayire mu karututsi abantu abo nimbashaba ngo babihe mu bishara bya government muhe za karututsi zanyu mu bishara bya government tuja kukore hururu kubinga abantu bona mu bishara abo kuba tuyine enteekateeka y'amaani ey'okukozesa amaizi g'ebisharara kutunguura embeera yanyu nitwenda kuta ebomba zirikutsindika amaizi kuzita omu bisharara zikatsindika amaizi omu migongo n'omu mpita mukabaasa kushukyerera emisiri yanyu n'entookye rero mukahinga omu njura n'omu mushana mukaguma nomwezi omwaka gwona eki ekyokushukyerera amaizi n'ekintu kikuru munonga ekirikwija kwiha enjara omuri Uganda ahabw'okuba twakikozireho imwe ab'entookye ezanyu ez'omu byaro bakanyangura umusharura tani 5 n'obucweka buke buri hectare ni nkahika 2 n'ekicweka konka nyowe hariya Nyaruzinga Bushenyi eyi turikubangira omukazi w'okweta Dr. Muranga we nasharura tani 53 buri hectare imwe ahimu kusharura hiki 5 we nasharura 53 buri mwaka ahabwenki abokushukyerera amaizi nigashangwahi omu bisharara n'omu migyera n'omu nfunjo n'ahabw'eki abantu abakugenda bakatahirira ekitara ky'amaizi ga Ruhanga ekyaterereho eky'ebisharara okaza kuhingamu otutakuri n'enanka n'obukozire n'enshobe y'amaani n'okutamu za karututsi n'ahabw'eki abantu nimbashaba ehurire etakatandikire mbe mwayerigire mugye tutaza kutsikana naimwe kandi kyamani kuyaba nagamba aha nahora nashima gavumenti kweteire ebyoma omuri Kahenge kubeheramu n'amaizi g'okunywa n'ag'enkyago okubeheramu amaizi g'okunywa omuri Kahenge kugareeta kugata kuno omu migongo kashaka aho kamwayeteera endobo amaizi ag'okunywa kandi agutukenda kukozesa kushukyerera emisiri kandi gomu kuhingamu emirenzi mugimanya bitewe kwa takumanya Runyango nimugamba rurimi ki ngamba Ruzungu gardens in the swamp tunagamba Ruzungu rwanyu konka amahambira agomu bisharara ninga agomu miga y'ebisharara bagete emirenzyo nareba emirenzyo kuriya nabwekyo nimbahabura nti okuza kuhinga okutamu karututsi n'okutamu ebitakuri n'ebindi omu bisharara n'omu nfunjo n'omu migyera n'enshobe deka emigyera n'ebisharara n'ebitara by'amaizi gaitu deka amaizi gagume garugonka tuje tugeheyo tugakozesa okunywa nkaga ga Kahenge n'okushukyerera emisiri. What I'm telling these people is that when I was coming, I saw that there was some encroachment into the wetlands, into the rivers, into the swamps, and I'm telling them that they should get out, and we have got a big plan to install solar-powered water pumps in the wetlands, near the wetlands, so that they can pump water uphill or in the flat area, in the plains, and we have irrigated agriculture instead of just depending on rain-fed agriculture. Ekindi ekya kashatu ebiraganiso ebinahurira chairman kyo mukama nagamba ebyuka n'ebintu bike speech yawe gihereze my staff get the speech of chairman. Ebimuka n'obuntu buke mbwenu basi ya ninkahali ya kinyasano weno ejo nendema nayo basi ya kinyasano milioni igana manyanka yaha nokutokwata jana na ofisi yanjye bita ubu n'obuntu buke sane ebinahurira by'amani n'enguto ezenguto turiyo ntwitekateka ntuja kukora ekikubasika hariho enguto eiturikukora hati eirikuza ishasha kuraba kanungu ejo ntushanka bagitegwire ziriya zindi erikuruga kuriya mtoma kwija harukungiri ejo nayo ntugimanya erikuraba okoruhinda hamwe n'eyakabira nayo nahorana mu kigamba kabira nkahiye ogwa kitagata ejo nayo tukaba twagigambire hariho n'eya erikuruga muhanga kwija rwamucucu kwija kisizi kwija kuzarabare ninga kufumikira kebisoni ntuzimanyezo konke ebyokukorana bingi ibintu nibyo by'amani bito ubundi basi ya kinyasano ubu n'ubuntu bucyo ubuntu tuja kubukoraho aho naho. I was talking about the pledges which the chairman was talking about. Because the chairman was talking about some small pledges, but what they call pledges, but actually these are plans of the government for infrastructure, like the roads I mentioned. I'm glad we have done one major one. There are about 2-3 others which we shall do as we get the money. But as for the smaller pledges, those will be fulfilled because they are not big. Now, finally, I want to thank the United States government for the support they have been giving to us in the issue of AIDS and other disease control measures. I also thank and as for the sustainable funding, we shall fund. There's no way we can fail to fund our people. There's no way. Yes, there are so many things to do, and as long as the donors are helping us to do some of these health issues, that's welcome. But if they were not able to do that for some reason, then we definitely would suppress other things and fund our people. So it's not really a big worry. It's a worry because it will stretch our resources, but we cannot fail to do it. We shall do it if it becomes necessary. But if the friends can continue supporting, that means we are able to put our other money into other areas and widen the spectrum of intervention. So therefore, for the Ugandans, my message on AIDS is number one, prevention. Because prevention avoids so many other complications and preserves the full potential of our youth. The youth, Secondly, in case you get infected, go for treatment so that you don't die and you live long. But remember, you will not fully meet your potential. This is medical, because I have been checking, and we had seen it in the army. Some of our people who were on these drugs, when they went into physical exercise, they collapsed. And thirdly, if you are on these drugs, please stick to them so that you don't relapse. Thank you very much.
Thank you so much, Your Excellency. Webare, ahabwe bihaburo byawe birungi, ahamukoro ogu, okutwakubasa kwerinda akakoko ka sirimu. Ntukusima ahabwire buwatwanka abanyarukunji na Uganda yona okwikiriza celebrating AIDS Day omurukunji. Your Excellency, nkokwe theme yeri izoba yabe ending inequalities among adolescent girls, young women and boys. Na ninkushaba muzeyi oyikiriza abana batabutu inaha bakuzanire tokabasa kuruga rukunjiri muzeyi tutakuzanire webare mnonga nimbashaba Immaculate Heart Chinyasano girls murafuche tubase entertaining guests bitera izoba kandi banu bija. Your Excellency nyenda kwebaza ahabwo bugabe bwatire nk'abacyara nk'abakazi okutkunda okatwesiga okatuhe mikono kurwanisa inequalities ezimwe ezitwantugamba omuryabo twinemu Vice President, Speaker, Prime Minister nangwana nanye okwemera ntebe y'abakazi ejo na affirmative action eyiwatuhire yebare muzeyi kandi gumiza muno tamamani. I want to recognize the bazukuru kurugom office a national chairman baryaha mwebare kwija mwebare mnongo. So entertainment bashira omukire kache mutereze ebimutwiniri mwebare.
Your Excellency, the President of the Republic of Uganda, I'm Ainemba Yvonne, and I'm a young person living with HIV, and I've come to say thank you so much for the support you've given us young people living with HIV. I am representing them, and we are grateful that we are in schools and we are stable in care. However, we have some of our fellow young people who are in schools and they are facing challenges like stigma due to lack of the effective information that is non-stigmatizing to be put in schools. His Excellency, we request that our education system can easily be integrated in the school systems of Uganda. We are grateful as young people living with HIV, and we believe that you taking the lead, we shall prevent the new infections of HIV that are rising. Thank you.
Dignitaries present, His Excellency, my name is Colette Kongai, a national YAPS trainer, a peer educator, a Miss Y Plus Eastern Region, and a first runner-up. I'm here today representing the young people, saying this, thank you so much, His Excellency, for your support towards young people. For this, we are here together, and we will end this. With your support together, we shall fight it till the end. A world without AIDS. Thank you so much. God bless you. All the implementing partners, may God bless you so much for your support towards us, the Ugandans, especially those living with HIV. Thank you so much for God and my country.
This is Immaculate Heart Girls School, Nyachivale.
Ugandans we tayari.
Ugandans, the people that slimed and died by 1980s, had pondered, wondered, and worried of the scourge that plundered and scarred the lad of the cage. Child delivery, sexual intercourse, germ transmission, and sexual intercourse. All in all, the people so perished. So, the echoes to redeem, widows, widowers, and orphans, were felt and scarred by 1986 percentage leaders to research and find, treat and heal their victims with high fever, diarrhea, weight loss, exhaustion, and sweaty glands. Yes, echoes to treat and heal, test and counsel, educate and cajole, and change the witchcraft mindset that ruin and disable the rest.
With tears cascading down my visage, do I say to you, my dearest daughter, I'm sorry, I've only remembered who you are to me on my deathbed. My daughter, I contracted this disease through drinking and smoking, and I was unfaithful to your mother. Oh, my daughter, please listen to me. I'm sorry I've only remembered who you are to me on my deathbed. Dear my daughter, I'm kindly asking you, please stay away from sex, abstain from it, and be faithful to your partner. Another request I have of you is to make sure that you keep safe from any kind of immorality, oh my daughter, and don't be as proud as I was in my entire lifetime.
Father, I forgive you. I promise to abstain from sex and stay away from early marriages. Father, I promise to treasure education and believe in science. I'll stay away from discourse, drug abuse. I'll stay away from any kind of bad company. Father, I'll keep my dignity. Please don't leave me. Father, I forgive you. Father! Father!
Today it's me, tomorrow someone else. It's me and you, we've got to stand, fight. We'll shed the light in the fight against AIDS. Let's come on out and stand together, fight AIDS.
And countrymen who would wish to die because of AIDS and fail to live longer beyond yonder. Who would wish to have their dreams thwarted and fail to see tomorrow because of the scars that first hit Rakai village of Kasesero on the shores of Lake Victoria. No, no, no. We said no. So, educators, mentors, politicians, heed to our cry that we all can use the prayer we recite. Oh Uganda, may God uphold thee. We lay our future in thy hands. Keep protecting us from the scourge. Keep us with transformative leaders, the far-sighted leaders with a vision to plan and secure our future. Keep us safe in our beautiful pearl with flourishing education, health, and economy to forever keep glorifying your name.
Your Excellence, Rukunjiri District supports you. Immaculate Heart holds you in high esteem.
To break the chains of ignorance and laziness, we strive far and high to make a better world. Wake up, girls, come and join the fight. Never to say we can't make it. Immaculate, the school with all the skills. Mentoring the girl to face the world. We make the girl child the pathfinder. We make the girl child the pathfinder. Your Excellency, the President of the Republic of Uganda, we would like to thank you so much for everything you've given to us as your grandchildren. And as Immaculate Heart, we have prepared a simple gift for you, which is going to be handed over because maybe it has to be taken through precautions. But Your Excellency, we would like to thank you for the education, for everything you've given to the girl child. And together with our sister headmistress, we are going to stand up and fight for the woman as the theme of today's guests, to fight for the lady, to fight for our position in society, so that together we can have a world free of AIDS. Thank you so much. Remain Immaculate Heart Girls School.
Mwebale mnonga ba Immaculate. Mubatere mungala ba Immaculate. Bagarucheyo. Thank you very much. Thank you very much, Immaculate. Thank you very much. Mubatere mungaro. Please. Meanwhile, iraba barikuzakugarukayo. Your Excellency, hano nyine ho rufumo rukujya nkotera bano batera bona. Nani nkushabango nyikirize. Ninkushabango nyikirize na kinyasano garus eina kantu kabo bakatekeho. Wabale munonga, Your Excellency. Kinyasano garus. Very fast.
This is Kinyasana Girls High School, and we are going to present a poem entitled AIDS, the Dreaded Vine.
Gradually, it struck Africa and the world at large. A disease so strange and mysterious. Its virulence raged, ramped and rapidly spread like wildfire. Through molestation and defilement, most girls and women succumb to the disease. Through blood contact and in many ways than one, parents' lives snatched away, leaving the innocent infants orphaned and mourning the unfairness of the price.
The fierce frame of the disease braces hurriedly towards adolescent girls and boys, breeding inequalities of rape, persistence, vile poverty. Yet, a lot to it to administer justice to the victims. We have greatly suffered the unfairness. We have endured the ridicule at the expense of those who do not understand our pride. Parents who treasure material things to their children have forced them into our marriages. A ruthless fire burns through our hearts, pleading for someone to hope, but a few can understand our quagmire.
For hope should always be alive. We are grateful to the President of the Republic of Uganda for the far-reaching support through the sensitization of the public about the Karos disease. The Reproductive Health Uganda has infused the boldness of the victims how to meet with denial, discrimination and mitigation approaches, the management of the STDs, provision of ARVs, and counseling on HIV, giving the youth, men and women an array of hope. Furthermore, for the initiation of the PRC program that has helped me manage in imparting moral values in the youth, we therefore express our heartfelt gratitude to the presidential initiative for lending us a shoulder to lean on in this testing situation.
Nevertheless, the unending corruption has denied justice to rape victims. The weak judiciary has claimed regarding early marriages. Inadequate medical care has claimed more lives due to embezzlement of funds by the corrupt leaders who divert the money into their individual pockets.
If there is one, only one out there, who will listen, who will open their minds and look deep within to find the will to speak for adolescent girls and boys to bring an end to the dreaded vine. Long live the President of the Republic of Uganda. Long live Nyasano Girls High School, I send mass for God and my country.
Thank you very much, Nyasano Girls. Thank you very much, Immaculate Heart.
Thank you so much, Your Excellency, for allowing the girl child to give us the entertainment. And with them, we have the HM Immaculate Heart. She's the best headmistress in Africa. Sister Kachope, we recognize your efforts. Thank you so much.
Thank you very much. Mwena, Ahabgomukoro. We now come to the end, and we are going to stand up for the national anthem. And immediately after that, I will request the receiving team to come forward to say farewell to our president.
right, thank you so much. Members of Parliament, mwebale kutuzwechera kandi mwebale no coordinating ajo mukoro ogu. We are done. I have a few announcements. Over there in the corner, we have health services, muzeyo, muchebeze, kandi mumanyama garaganyo kugemereire. We also have blood donation services over there in the tent for Red Cross. So muzeyo, to donate in Shagama, to end up seeing all the teams that have come. And as the president sets off, I want to invite all of us for lunch. Organizers have prepared lunch for all of us. VIPs will be going to Rukunjiri Inn to have lunch, and all other invited guests will be heading to Makowole High School. We shall have our lunch there. I can see the president warming, going to see the band. Chatoko Brass Band, please take this chance. Mwashemeza president. Nando kundi kuleva, no shamwariamu. I can see you are about to receive a khaki envelope. Oh yes, thank you so much, Your Excellency. Kandi Abachatoko, Mwariamu, thank you so much for entertaining us. Like I said, the organizers prepared lunch for all of us. VIPs, you will be led to Rukunjiri Inn. We shall have our lunch there. Then the rest of the invited guests, we shall all head to Makowole High School